Okay, the first step is I'm going to review my orders with the patient. Procedure is a physical assessment. There's no activity restrictions. Next step is gather all my equipment, stethoscope, pen light, gloves in case I come in contact with bodily fluids, and a piece of paper or tissue for the sensation test. Next thing I'm going to do is knock on the door and walk in the patient's room, perform hand hygiene, introduce myself to the patient. Hi, my name is Rini. I'll be your student nurse today. Can you go ahead and tell me your name and date of birth?
Aaron Montano, 12/27/1997.
Okay, do you have any allergies?
Nope.
Check in now with my orders, making sure they match. So today I'm going to do a physical assessment on you. Okay?
Yep.
So I'm going to provide for safety, making sure the bed's locked, both rails are raised, provide for privacy. I'd elevate the bed. I'd obtain and assess vital signs, and then I'd assess for pain. Are you experiencing any pain today?
No.
And if you were, I would check for quality, location, intensity, timing, radiation, and any palliative or provocative factors. Then I would do a skin assessment, so I'd check for color and uniformity. So I would check for any signs of jaundice, any pallor, or any cyanosis on the lips, the palms, or the nail beds, and there's none present. And then I would check for the moisture of the skin, the temperature, the texture, and your skin is warm, dry, smooth. Next, I'm going to pinch you on your arm. Is that fine? To check for dehydration. So let go. The skin turgor has no tenting present. Then I'm gonna check inside your mouth. Can you open your mouth for me? I'm inspecting for any the color, the moisture, and for any lesions. Color's pink. No lesions, and your mouth does have moisture. Now I'm going to check all your bony prominences for redness and any skin breakdown. So I'm going to check your elbows. Go ahead and turn on your side. Check your sacrum and your coccyx, and then your heels. And you do not have any sign of redness or skin breakdown. You can go ahead and lay back down on your back. Check for any IV lines or drains, none present. Now I'm going to do a neurological assessment. Your level of consciousness is alert. You've already told me your name. You've been answering some of my questions. Can you tell me what day it is?
Saturday.
Can you tell me where you're at?
The hospital.
Okay. Are you experiencing any headaches?
No.
Blurred vision?
No.
Double vision?
No.
Dizziness?
No.
Ringing of the ears?
No.
Any numbness or tingling of the face, arms, or legs?
No.
Okay, your speech is clear. There's no gargled or slurred. Can you smile? There's no, go ahead and do that one more time. There's no, your face is symmetrical. There's no drooping. You stick your tongue out. Your tongue is midline, no deviation. And then now I'm going to check for I'm going to check your pupils, okay? So pupils are equal and round. I'm going to check for constriction. They are reactive, and then now you can look straight up, and I'm going to bring this down to you. Both pupils accommodate because they're converging, so your pupils are equal, round, reactive, and they converge. Go ahead and open your eyes up again. I'm going to check the sclera, which is the whiteness of your eyes. I'm checking for the color, any redness, any drainage or lesions. color is white, no signs of redness, drainage, or lesions. I'm gonna have you sit up for me. I'm gonna check your grip strength, so go ahead, squeeze onto my fingers. Okay, good. Your grip is strong and equal on both sides. I'm gonna grab your wrist and I'm going to pull it, so go ahead and resist. Okay, now I'm gonna push, go ahead and resist. Good. Okay, you can lay back down. Your arm strength is strong and equal on both sides. And now I'm gonna have you push like a bike. Good. I'm gonna have you pull back. Good. Your leg strength is strong, regular, and equal. I'm gonna have you sit up at a 45-degree angle for me. This is a hospital bed. I would be able to raise it myself. Okay, that's good. Are you experiencing any chest pain?
No.
Okay, so I'm gonna assess for any neck distension right now, any jugular vein distension. So go ahead and look to your left. No presence of JVD on that side. Go ahead and look to your right. No presence. Okay, so I'm gonna check your carotid pulse right now on both sides, one at a time, okay? Your carotid artery is strong, regular, and equal on both sides. Can you go ahead and take your shirt off and sit up for me?
Yep.
I'm gonna listen to some of the sounds on your heart, okay?
Yep.
Okay, so you got your clavicle in your first rib, your first intercostal space, second rib, second intercostal space, which is right of the sternum, is going to be your aortic valve. I'm listening for the rate and rhythm. Then I'm going to go to the left of the sternum on that second intercostal space. Listen to the pulmonic valve. Then I'm going to go to the third rib, third intercostal space, fourth rib, fourth intercostal space. Listening to that tricuspid valve. Then, go to the fifth rib, fifth intercostal space, midclavicular line. Listening to the mitral valve. Your rhythm and rate is strong, regular, and equal on all four valves. I'm going to assess for capillary refill. So squeeze. The refill is less than 3 seconds, so that's within normal limits. And now I'm going to check your dorsalis pedis pulses on both sides. They are a +3, and they are strong, regular, and equal on both sides. And then I'm going to check your posterior tibula. +3 again, strong, regular, and equal on both sides. Now I'm going to assess for edema, checking the legs, the anterior tibula, and the ankles. No presence of edema. So I'm gonna use this pillow, have you sit up a little bit more. I'm gonna start doing my lung assessment. So are you experiencing any difficulty breathing?
No.
Shortness of breath?
No.
Coughing?
No.
If if you were coughing, I would check I would assess for the characteristics of the sputum, and I'm just gonna listen to the respiration and rate of your lungs, checking the symmetry of expansion, the ease of breathing, and also checking to see if any accessory muscles such as the abdomen or neck are helping you breathe. So now I'm going to have you breathe deeply through your nose and mouth. Make sure you're breathing through your mouth too, breathing out. I'm going to take my stethoscope and listen to some of your lung sounds, okay?
Yep.
So I'm going to start above the clavicles on both sides and work my way down, doing it 6 to 10 sides on that front, that anterior, and then I'll move to the back, okay?
Okay.
I'm listening for at least one full respiratory cycle. Go ahead and lean forward for me. I'm going to listen above the scapula, starting off. Okay, I've checked 8 locations, so you can go ahead and lift your arm up, off to your side. I'm gonna do 2 spots on the lateral sides. Put your arm down. Put that arm down. Your lung sounds are clear. You can go ahead and lay back down. Last part I'm going to do is the abdomen assessment on you. Are you experiencing any nausea, vomiting, diarrhea, constipation?
Nope.
Any difficulty urinating?
Nope.
Okay. So I'm going to inspect your abdomen. I'm looking for symmetry, contour, nodules, scars or lesions. Your abdomen is symmetrical, no signs of any of the other things. Now I'm going to listen to your or not your lungs, but your bowel sounds on your abdomen in all 4 quadrants. You have activity in all 4 quadrants of the abdomen. Next, I'm going to gently touch your abdomen, okay? I'm checking for any tenderness, firmness, rigidity. Let me know if you're experiencing any pain while I'm doing this. I'm also making sure that you're not guarding, and I'm looking at you to see if you're doing any grimacing as I'm palpating all 4 quadrants. Lastly, I'm going to check your bladder. I'm going to gently touch, making sure there's no distension, discomfort, or rigidity. None present. You can go ahead and put your shirt back on, sir. Go ahead and lay back down for me. I would lower the bed. You want your guardrails up or down? Okay, I'll just leave them up. Then I hand you your call light. Perform hand hygiene. And then I document any of my findings.